be the soldiers, of this cause, because it's a movement. This, we want them to be our spokespersons. They can make reels on these type of needs. They can spread awareness over there, or they can also help dementia, because it's a voluntary organization. Dementia India Alliance is a voluntary non-profit organization.
So, hello, myself Dr. Mukul Jain. I'm an assistant professor in Parul University. So, today we have with us S. Premkumar Raja, and he is the secretary of DAI, Dementia Alliance India. Now, I first welcome to the Parul University. It's good to have you here. So, just give a glimpse introduction about yourself, and then we can initiate it.
Thank you so much, Doctor, for having me with you today. And to introduce myself, I am Premkumar Raja, based in Bangalore. I'm the secretary and co-founder of Dementia India Alliance. I'm also the secretary and co-founder of Nightingale's Medical Trust, which is an NGO working for the welfare of the elderly and those with dementia.
So first a question in this particular Alzheimer month of 2025, that what is dementia and what Dementia Alliance India is doing for it?
Well, so dementia is an emerging epidemic in our country. It is estimated we have over 1 crore elders in India with this problem. This number is expected to double maybe in another 15 years. Dementia India Alliance is a national organization established about 2.5 years back to connect anyone concerned about dementia together. In India, when you talk about this problem, the awareness is so poor and a lot of stigma attached to this problem. More than elders with dementia, the families, they suffer a lot. And so far, there's no cure for this problem. It's a very important social and healthcare concern. And we need more awareness, and we need more support services to help those with dementia as well as the families. Yes, people are working in silos in different areas, and as I said, I have been working through Nightingale's Medical Trust in the space of dementia for over 2 decades. So at the time we realized it's a need. I think we have organizations or anyone concerned about dementia should come together. That's how Dementia India Alliance was established. And it's an umbrella organization primarily to bring anyone connected with dementia together, so that we can create an ecosystem to build the cause more effectively.
And how Parul University, as we have the largest number of students, we have more than 60,000 students, how Parul University will join this initiative of Dementia Alliance India? As we know, we have so many elders are there. Now, as you mentioned that with the age, there is the age of we can say longevity is at a high pace, and we have 69 years of age is there. So how can we initiate any particular program with the Parul University and Dementia Alliance India?
Well, I'm just so happy Parul University today organize this awareness program to sensitize students here. So that itself shows Parul University's commitment to this cause. I see tremendous scope for the collaboration between the Parul University and Dementia India Alliance. As we mentioned, as I mentioned, Dementia India Alliance is an umbrella organization. We would like to connect anyone concerned about dementia to come together. And here today, after interacting with the students and some of your faculties, I feel there's a tremendous scope where both can work together. One is to build awareness in the state of Gujarat as well as in the city of Baroda. We can definitely, I think Parul University can play a major role. Secondly, students, so they are the future. Students, they need to be sensitized, because when the students know about this problem, they can go back and talk to their elderly grandparents about this and take the message home and see, maybe encouraging them, to have memory screening early or maybe in time. And thirdly, if they see anyone with severe memory issues in their community or their dear ones, they can ask them or request them, in order to seek medical help. Students, we feel they have a lot of potentials, and students can visit old age homes or maybe aged care facilities as interns or as volunteers, spend the time over there, and that will be really great big relief, like a big help for these institutions. Students can get trained, because training is something going to be very, very important. They can be maybe they can even become trainers. That's how Dementia India Alliance can help students to be the trainers, so that they can train more number of people wherever they are there. And research, that's going to be very, very important program or important thing the coming days. And I see being such a huge institute with 65,000 or 60,000 students, with medical colleges and engineering colleges and all other related education institutions. Definitely, Parul University can play an important role in promoting research in these areas. And since the medical institutions, colleges are there, and Parul University can start with memory clinics, and also going forward, they can even think of having geriatric wards. As you rightly said, the number of the elderly in Gujarat compared to other states, the prevalence is more. Definitely here we need more awareness, and they should be encouraged to take medical help, maybe when they have severe memory issues. But the awareness is very, very important. I'm very sure Parul University can play a pivotal role, in promoting the cause of dementia in the state of Gujarat in a more proactive way. And the Dementia India Alliance will be very, very happy to work with the university to promote the cause.
As you have mentioned in the session also, there is a particular program known as Dem Champs. So would you give me a brief introduction about Dem Champs and how students get enrolled in that particular Dem Champs, and how they are going to get a certificate, or they are going to work for the real time population? How it would be beneficial?
Good. And so we believe, one is Dementia India Alliance, when we established, we know the importance of family carers, because here half of 50% of our board members are family carers. And when we planned our activities, or when we conceived the whole organization, we felt the need of involving students in a moment. Because students, we felt especially the family carers, they felt they are going to play a very, very important role in bringing the necessary changes in a country. That's very important. And we thought about different activities. We had discussions with students, and that's how we came out with this Dem Champs programs. So students, especially the streams of psychology, social work, nursing, or maybe these allied health sciences, they very much align with this cause.
Yes.
And they study, and also they look for some sort of career opportunities in this area. So Dem Champ is a program where we try to identify students interested in this space and encourage them to learn more. So once they sign up for Dem Champ program, they get a lot of educative materials. It could be in the form of videos, or it could be in form of booklets. So they get to know more about it. And whenever they have any questions or doubts, the experts from Dementia India Alliance, will answer the questions, so that they get to know more about the problem. Secondly, we expect them, to be the champions, in the sense, wherever they are. One is first is in their families. We expect them to go and talk to the elders in their families about this, and encourage them to to have memory screening once they reach maybe once they are 60 plus. Next is if they see anyone with severe memory issues, the families or in the communities, we want students to encourage them to take medical help, to seek medical help.
Yes.
Because we see a lot of stigma attached to this problem, and people don't like to talk about it. When students go and talk, we strongly believe elders would take it more seriously and avail or seek medical help on time, which is very, very important. And also, what we see nowadays, children becoming more and more getting involved with the mobile phones, or maybe other maybe computers, etc., or social media, etc. The time they spend with elders is really coming down. The gap between youngsters and elders is widening. So we encourage our champs to go and spend time maybe in the old age homes, or maybe organizations involved in aged care, to spend the time productively. When they go and spend time in this type of institution, they automatically get more sensitized about this issue, important serious issue, and they can really contribute in a more meaningful way to make the lives of elders better. And there are some students, like, now when you see the numbers, you see in India we have 15 crore elders, and we know about more than 1 crore elders with this brain disorder, dementia, and the number is going to increase. And what I see as a social entrepreneur, I see there are a lot of potentials, like, where students can get involved and they can pursue the career. So maybe the children, like, want to work, or students want to work in this type of institution. Definitely the need is going to be more. And when secondly, like, those who want to be social entrepreneurs, or maybe entrepreneurs, like, they want to be independent, and I'm very sure it's the area. This is the area in the coming years. Lot of scope there, and being Dem Champ, like, definitely DAA will help them to know more about it, to pursue the career, and also place them in different places as volunteers and interns, to get to know more about the dementia space. And finally, we expect the students be the soldiers, like, of this cause, because it's a movement. Like, this, we want them to be our spokespersons. Like, they can make reels on these type of needs. They can spread awareness over there, or they can also, like, help dementia, because it's a voluntary organization. Dementia India Alliance is a voluntary non-profit organization. Students can, like, help us, like, raise resources wherever they are, and DAA would be very, very happy, because this is whatever I told you. This is what we have think, but we are open to, like, having dialogue with students. If they need more support, I think we'd be happy to offer. And it's a very small fee of about 250 rupees. It's for about a 1-year period, and this is where we expect them to do it, and we'll offer all possible support. And in the end of the maybe the program, they all will get nice certificate from Dementia India Alliance, and this will definitely help them, like, add a lot of value to their CVs. I'm sure that, like, children want to work here or going abroad, this certificate, I'm sure that will add more value and help them pursue careers, or maybe do further courses in this space.
As you are a part of higher management, you are working with many doctors, many psychologists, nursing. What are the problems you are facing for so many years? Means tackling with the government, with the CSR activity, with the different organization, or the people. What are the problems you are facing as a member of or as a secretary of DAI or an Nightingale Medical Trust?
Well, see, the problems when you talk about different ways. One is, like, the major problem, the HR issues. Like, maybe for us, even nowadays, getting caregivers. Like, there is nowadays youngsters don't like to do this type of job. There's a huge dearth of trained caregivers. Huge dearth, because people are coming, but still they're not trained. Getting trained caregivers, is a major challenge. Not only Nightingales or Dementia India Alliance, even other similar organization face this problem. We need to, like, maybe focus more on that. There's a huge dearth, and we have to maybe make government, like, recognize this need, and encourage people, like, to get trained in a proper way. But this type of training, it's not only theoretical. Here you need, like, hands-on. You need hands-on, that practical trainings are required. So we need good quality training programs. And Bangalore, we are doing our best to offer this type of training programs. And whatever, as NGO, say Dementia India Alliance, here's a national organization, but it's an NGO. Or maybe Nightingale Medical Trust, or like my other, maybe the founding members. They're all small. In whatever we do, we are good. Maybe the areas where we work, the impact that we make, it may be very, very, very small. In a country where we have 1.5 billion elders, definitely we need to make a larger societal impact. This can happen only with the involvement of government. Working with government, it's very, very important, but it's not easy. When you talk about in our country, we have a lot of other social priorities, social problems. Government definitely, like, has to consider all the problems. So obviously, you can't expect maybe dementia to be considered sort of with due recognition. It takes time, but at the same time, without involving government or without necessary policies, we can't bring the necessary changes. Policy changes are important, and I'm happy to inform maybe DAA, in the past 2.5 years, we have been quite successful in bringing policy changes. Number one is in Karnataka. Karnataka government has already announced dementia has a healthcare priority, and there's a state action plan through which, we want to promote the cause more effectively. There are various stakeholders. Same way, Tamil Nadu government, we had some very good meetings with the higher government officials. Hopefully this month, government of Karnataka will recognize dementia as a healthcare priority and come out with a state plan. And we have been quite successful in the Union Territory of Pondicherry. Maybe this month, because it being dementia, this is a World Alzheimer's Month. We want these things to happen faster, because once government recognize dementia as a healthcare priority, then definitely maybe other things will happen, because that's what first thing we want, and the action plan. And Andhra Pradesh, we are working, hopefully in the month of November or December. I think we feel December we are having our national conference in Visakhapatnam. So we expect more than 800 delegates to attend over there. We are expecting our health minister there to come and announce this policy that we are working on it. And Gujarat, if your university could help us, DIA would be very, very happy to maybe work with you in reaching out to government officials and maybe sensitizing them about the need of it, and working with them and offering all technical support in seeing that how Gujarat also can come out with suitable policies. And when you're doing this conference, I appeal, because a lot of students interested today, maybe during my interaction, I could see students asking very interesting questions. We have special sessions, in the sense we encourage more students to take part. If we have special rates, the rates are highly subsidized for them. I appeal to students please visit Dementia India Alliance website. The details about the conference are there. I appeal to them to please come over there. When you come, you get an opportunity to interact with the experts, and you will get to know what's the problem and how to go about it. I'm very sure this type of initiatives will definitely help Parul University, as well as the students over there, how we could have more meaningful collaboration.
As we have many departments, number of students are more. We have social work, we have law students. They all are related to this dementia policy, as well as nursing department, physiotherapy department, medical. We have all the section. How MOU would be useful with Dementia Alliance India? How students can work in this particular MOU, under this MOU?
Well, see, once we feel both of us can work together,
yes,
definitely DAA would be happy to get into a MOU with Parul University. So what are the areas we said? One is, we become partners. DAA, we know that there's a national organization. We can't do everything ourselves.
yes,
And India is so diverse. Here, whatever we plan in Bangalore may not be appropriate in a place like maybe Baroda. We have that to be cultural sensitivity is very, very important, and we have to be quite careful when we plan these activities. This is where and so we try to fulfill our goal through identifying suitable our outreach partners, because outreach partners they play a very, very important role in promoting the cause. So right now we have about 19 outreach partners in different places. So this MOU will enable that. So once you become our outreach partner, we'll offer all technical support to build awareness, organize training programs. We will train a few members of your faculty as trainers. They can organize regularly training programs over here. Tomorrow, if you want to set up any support service, like maybe memory clinic, or if you want to do any daycare facility or maybe dementia care facility, the hospital will be happy to offer that particular support and advocacy. That's very important. Both of us can work together, because what things will work over here. We can go together to the government officials and see how policy changes can happen over here, and reaching out to old age homes. The students can reach out to that be getting involved over there, and to research, students interested in research. If they want to come to Bangalore, and trying to take any research that we can definitely allow them, like sort of to do that. So these things are there are many other areas where we could work together to promote the cause more meaningfully.
Any last statement you want to pass or you want to deliver to the students, that how we can able to ignite them so that they can work for these elderly people or work for this particular social work? Actually nowadays people are running toward the US, UK. They want to pursue a job, but they are not working for the humanities. Any last statement you want to pass to the students?
Well, I believe strongly students are the future of the country. I know maybe students may be attracted with a few things abroad and they may like to go out. No doubt, there could be some problems in a country, but nothing is like our country. I appeal to students, whatever you do, please try to do in our country. Our country is growing in all aspects. This is really golden era. People are looking at us. Yes, unemployment problem nowadays is quite, people are quite concerned about that, AI coming. But the area like dementia I'm talking about, whatever happens, these things are not going to affect this space. People need care because the numbers are going to be more in the coming days, and more care facilities are required. Students definitely need a good future. I appeal to you. Please consider, especially the students who are doing psychology, social work, or medical related, anything related to aged care or anything related to dementia care. There's tremendous scope in the future, and if you are enterprising, definitely you can run some meaningful programs. And please, whatever you do, try to do in our country and make a difference in our country. And for that, whatever possible from our side, Dementia India Alliance side, we'd be happy to extend. And you have tremendous potentials. Please don't undermine. You are tremendous. You can change. So we need your involvement. So you have very good ideas. So today, maybe when we had this interaction, I could really make it out. Your ideas are better than about what we think. Please, you have potentials, make use of it, and the process, you will be leading a more enriching lives, and also you will be enriching others' lives. And finally, our country can grow, and we need not depend on anyone. For this type of care, what I'm telling you, India maybe become a leader in this space, making other countries learn from us. So that much scope is there, and you have excellent facilities, you have very good faculty members, very committed team, and you are in the right place. Please make use of it, and through, having this type of collaborations, we can also offer all technical support so that you can be a more responsible citizens of the country in the future. Thank you.
Thank you very much. With this last statement, that yes, we can change. It's an initiative that we can change or we can eradicate this particular disease, dementia, from our nation itself. Thank you. Thank you very much. Thank you, sir.
Thank you. Thank you.